Maternal, Newborn, Child, and Adolescent Health at UNICEF. Dr. Pearson has spent past 20 years advocating for women's and children's health causes in places such as China, Pakistan, Nepal, Ethiopia, Hong Kong, and United States. Welcome, everybody, and thank you for your time and being here today. So we will start with Wazima. She's a peace, as I mentioned, women, peace, and security expert. Wazima, can you talk a little bit about women and with keeping women and girls in mind? What do you see as the greatest security threat in Afghanistan? And what do you see as the greatest opportunity for peace? And also, additionally, if you can share some thoughts on competing challenges between, on one hand, it's the struggle for getting access to healthcare. On the other hand, it's bare minimum survival. People are just trying to stay alive. So how do you kind of align that? Although they're not exclusive of each other, but it's a kind of a, what do you do in such a situation? Over to you, Asma.
Thank you, Dr. Vineeta, and I'm very much honored to be part of this discussion. And I hope that these conversations continue, because the crisis right now in Afghanistan is taking a huge toll on women and children particularly. So I just want to set the context, particularly in this conversation, what happened after August 15. And of course, we also have to remember that the situation of women and children, women and girls in Afghanistan has not been ideal even before that, right? The mother's mortality rate, for example, every 30 minutes, a mother, for example, dying from pregnancy-related complications, or, for example, women's access to health, clinics being bombed by the Taliban, for example, and the clinics that were built by international members were politicized, they were attacked. So we already had, and of course, because we already had a war going on, the investment or the funding to the healthcare was very, very limited. But what happened after 15th of August, when Kabul before 15th of August, many other provinces, but then Kabul was taken over by the Taliban. So the next day, of course, thousands and millions of women could not even get out, right? Like doctors, nurses, female members of parliament, female ministers, nobody. So that was the first kind of, the setback, that women were excluded from even being able to get out of home. And then things started to kind of unravel further, or Black women lost the opportunity to work. Little girls, even grade 6 above, are not able to go to school, for example, right now. And, I work with a network of women local peace builders network in 34 provinces. And we have 200 women and men as our members. And the daily reports that I get and these 2 months have been very, very pathetic, particularly in terms of women's mobility. So the first thing has been women's mobility have been hampered drastically. Even nurses and doctors in the provinces, last week, I looked at the reports, that they cannot go to work. One is the salaries, of course, that they are not being paid. And then most importantly, that fear of reprisal, the fear of revenge. Many of these women, for example, who treated the victims of violence, who treated, for example, rape victims, women victims of sexual abuse, for example, their perpetrators are after them. So I have actually been helping a number of doctors, getting evacuation from Afghanistan. People are asking, oh, the female doctors are not at risk. And they don't see that, the security for doctors and medical personnel is so much complicated as well, because they are now facing reprisals. Remember when the Taliban took over, all the prisoners were freed without, and it took us years to put the perpetrators of violence, in jails and indict them or put them into the justice system, and all of them have been freed. Women who had, been raped, like the reports even that we have shows that the perpetrator has now come to, forcing the family to marry her. So things are such have started hampering the security and women's mobility. Access has been very much the first, challenge, the access to healthcare. And at the same time, because the women and female members of the healthcare, sector is not going to work, then women who are in need of it are not able to access it as well, because the families do not allow women to go to a male doctor. So in the other, setback is the schools, for example. When grade 6 to 12 are not able to go to school, you will not have doctors in the next years. We had the last year of Kabul Medical University, the last year students who were deprived of doing their final exam. So some 100 female to-be doctors are now sitting at home. These are kind of, dire realities on right now, especially from the women who have been in healthcare. Because for now, you hear a lot of media saying there are no issues for women in the healthcare. Women doctors and nurses can go to work, but it's very complicated because, of course, the access is very much in mahrams. For example, in Samangat, the female doctors were not able to go to the civil hospital because they did not have mahrams, which is a male companion that should come with a woman. So all of that, the security has added so much complications for women's access to healthcare.
Thank you, Wasma. It's so, as you mentioned, the situation was very dire even before, right? And now it's gotten worse. Any thinking, like, is there any ray of hope, or where is it that we need to kind of focus on? Like, it's just heartbreaking that the women and the young women and girls who worked so hard to get to the final year of exam to become doctors. One, it's their personal journey, and then second, it is a loss to the country today and in future. So anything that you see as a opportunity or hope?
Well, I hate to say aid for now has become the only dependent for many of Afghans. So, like the international aid organizations who are helping in the healthcare, there's a lot of hope from, WHO, UNSF, UNFPA, and other UN organizations or other international organizations that have been supporting the healthcare sector to continue, providing that support, but also providing the support that conditionalizes, the engagement and inclusion of the women in the health sector, because it's not just women as doctors, right, or women as nurses. You have women in the health profession, women managers, women in public health, the management of health as well. And it makes it very hard if you do not have women in the sector, because the access to the communities, we have a very rigid, culturally inaccessible homes in many parts of the country, where the family would not open their door to male doctors, male workers, male vaccinators, for example. So the aid, sadly, is one of the dependents at this point, that the aid organizations, the money that was pledged to Afghanistan in Geneva earlier, we heard it's around 100 million or $1 billion of dollars. We are not hearing what happened to that, right? Why it's not reaching to Afghan communities. So we need that to be accelerated, of course, and besides other, food security issues. But at the same time, it's also political. I see healthcare and very political as well. So, international countries, missions, all these foreign missions that keep meeting the Taliban, they do not even include women in their delegations. You saw Dr. Tedros from WHO. He was one of the first delegations that visited Taliban. And there was no single woman, traveling with him from Geneva. And we were asking him, like, are you under the Taliban rule as well? Are you being banned? So why women doctors from WHO are not part of your delegation?
That's really, really disturbing that the international organizations are not rather creating a model to follow than following into the Taliban's model. So let me move to our next panelist, Heather. Heather, what are you hearing and observing in Afghanistan from a human rights perspective, particularly regarding health rights of women and girls. Is there any ray of hope to hold on to?
Thank you so much, and thanks for inviting me. It's a terrible task to have to go after Wajma because she's like given us a sort of a sprint through all of the issues very quickly. I guess just to add a few thoughts to what she's already outlined, which was really helpful. I mean, one of the sad things is that the health sector is in less trouble than many other areas of women's rights, unfortunately, because I think the Taliban don't fundamentally object to women getting healthcare. They do a lot of things that make it difficult for women to get healthcare, but they don't actually oppose women having access to healthcare in the way that they do seem to still oppose women having access to education and women having access to employment, except in a very narrow way. So, you know, what we're seeing with the health system is playing out against this backdrop where you know, the Taliban is putting back in place policies that are pretty similar in many ways to what they had in 2001. And, you know, Wajma has already talked about some of the consequences of that. You know, you won't have a pipeline of new health workers if you're not allowing women and girls to study. But I wanted to talk for a minute about the international community a bit more. Because I guess I'm part of it somehow. And my organization spends a lot of time trying to beat up on donors and other organizations that are part of the international community in Afghanistan. As Wajma said, the biggest threat to women's access to healthcare right now is that the healthcare system is collapsing. And that's because of the actions of the international community. That's because this is a system that, you know, is part of a government where, you know, a month and a half ago, 75% of the funding for the government was coming from international donors. And then that was turned off essentially overnight on August 15th. And so I saw that there was a protest today by health workers saying they hadn't been paid in 11 months. We published a report, I'll put the link in the chat, but that came out in May that looked at how the healthcare system in Afghanistan had already been devastated by the fact that donor funding to the sector has been falling pretty steadily since 2014 or so. And so, you know, these new blocks in funding come on top of what was already a very, very weakened system. So in terms of hope, I hope the international community gets their act together. And there was news yesterday about UNDP administering a new system to temporarily pay healthcare workers' salaries. But I don't think there's been the kind of urgency that there should have been within the international community. And I don't think that they have seen themselves as responsible for what happens to women in Afghanistan in a way that they should after 20 years of playing such a very bossy role in the country. I'll stop. Thanks.
Thank you, Heather. And it's just mind-blowing. On one hand, they do not oppose the healthcare per se. On the other hand, the conditions such as girls, like Wajma mentioned before, girls are not being allowed to educate, to go to educational institutions or complete their medical education. So it's just almost, even though they're not opposed, they're just denying women and girls healthcare. So I want to move to Sadika. So Sadika, what are some of the key social determinants of health at play in Afghanistan under this situation that we are talking about of extreme fragility and then political uncertainty? What do you think some of those key social determinants of health are?
Well, thank you, Dr. Vineeta. This is a very broad topic, as we know, and just unpacking this in the context of Afghanistan will take us hours, but to highlight the magnitude of the damage that has already been done to the health system and the aspect that should be looked into to revive the system if there is any political will on the ground in Afghanistan, and as well as on international community. From structural point of view, two aspects cannot be overlooked at all.
And one is the socio-economic and political context that we are living in now. And the second is the socio-economic position of the current government, as well as the people of Afghanistan. Because they both are at high stakes right now. And let me explain how and why. So if you look at the governance structure, it is not what the international community wants. It is not what the Afghan people support, although we hear from the Taliban over and over that this is the system, that we are actually the people that are supported by Afghan people, that the Afghan people have fought for this system, for this regime for the past 40 years. That is a one-side conversation, one side of perspective. But this is, we know that this is not a governance system that is supported by the Afghan people, nor by the international community, and even by the regional actors. So this is not an inclusive system. And when we are talking, when I particularly am talking about inclusivity, I'm not, and specifically when it comes to the health sector, I'm not even referring to the ethnic composition, the Tajiks, Uzbek, Hazaras, and Pashtun. I'm more talking about the expertise in the health sector. So who are the experts and who are the people with values and beliefs? And right now we see, we see the cabinet of the current government. They all have the same values. They all have the same belief system. There is no expertise when it comes to the health sector. Now, looking at the economic status of Afghanistan, again, as Bajma indicated, and also Heather, the country is at the verge of collapse. World Bank, IMF, European Union, they have halted all their development projects. And you can see like $9.5 billion, and this is the public money that is frozen in banks in America as a way to basically sanction the Taliban. But I would say they're sanctioning the people for no good reason. People don't have access to their funds. People, and that has affected the food supply chain. People don't have food. Health facilities are running out of health supplies. They don't have medication. And as Wajma said, the health professionals are not paid for months, and they will not be paid. And they see that the current government is not even capable of paying the salaries. So that all brings disappointments into, the disappointments that are caused by the collapsed economy of the country. Now, looking from the social and public policies perspective, again, there's no policy right now that is in effect. Well, I wouldn't say that we did not have policy, we do, but they are not in effect anymore. And there is no capacity to even revisit those policies. There is no will actually to revisit those policies. And certainly I don't see any expertise for those policies to be revisited. And let's say those policies will be revisited and refined according to the new belief system of the Taliban. But how are they going to be implemented if there is no way to finance them? And finally, it's very important to see the social and cultural values that are put on the policies that will be shaped in the future. So the importance of policy values play an enormous role on whether women will be part of those policies, how their health and well-being will be given importance, and whether the system will be gender mainstreamed or not. Although they are saying that, we want a female client, a female patient to be visited by a female doctor or a female health professional. But again, these are the people who are fearing persecution. These are the people who have worked with international organizations, who were outspoken, who are advocates for the women's rights and the health sector. So again, whether those voices will be in the new policies, whether the new policies will be shaped by what the Afghan women on the ground want. So right now, it's what we see on the ground. It is very grim for women's voices to be part of policies and for what women actually want, what women actually need. There's a need for a political will within the Taliban government, and as well as some ease from the international community side. There should be some kind of accommodation. Thank you.
Exactly. And we'll come to the second round of conversation. We'll talk more deeply about it. As you said, we can not even start to begin to peel off the first layer of onion in this conversation, but I hope it will catalyze more interest and people would have more conversations deeper and more in ourselves as well. So like you mentioned, World Bank, IMF, and other institutions froze their accounts, and all of them have a policy, a set policy, how to function in fragile or conflict situations. And it's just very unfortunate that when it comes to actually implementing that policy, they just freeze and sit on the fences. So that's one of our calls in the end. We'll talk about call to action in the end. So moving on to Gulali. Gulali, from your own experience working in the region and also through your deep connections, what are some of the challenges that girls are getting and women are getting access to healthcare, including reproductive health? Any thoughts on addressing those questions, or whichever other conversation, whichever direction you want to take this conversation?
Inviting me. It's really great to be among such eminent speakers. And Vajma has really laid out the conversation when she highlighted the most important question, that it is expected from Taliban to erase women's identity. But what is happening with international organizations? Why international organizations are erasing women's identity by not including women in their delegations? Why international organizations are going in an all-men delegation to Afghanistan? They are playing the role of culprit in erasing identities of Afghan women. And I also want to highlight that we, the women, knew that with a haphazard withdrawal of US military force from Afghanistan, the country will sooner or later collapse and it will become a humanitarian catastrophe. Yet no preparations were made by the international humanitarian organizations. The international organizations tried to, sorry, not the international organizations, the international political community tried to sell a false narrative to the women of Afghanistan, telling them that Taliban have changed, they have learned from the past. This was a betrayal to the women of Afghanistan who have suffered war, suffering, and insecurity for more than 4 decades. People of Afghanistan, especially women and children of Afghanistan, should not be abandoned. With the healthcare system near to collapse, today, a woman in Afghanistan who is about to deliver a child, she does not know where to go for delivery. The safe houses, the safe houses have been shut down, and if a woman is becoming victim of abuse, she does not know where to go. Women in refuge of the shelter houses have been sent back to their homes with their abusers. So they are becoming more vulnerable to the Taliban, as women who are living in shelter houses. Most of the speakers have already mentioned about the withdrawal of the World Bank fund from Afghanistan, but kind of to put it in perspective, that the grant that World Bank was giving to Afghanistan, it was like 30% of the public spending, and with that funding gone, more than around 20,000 healthcare centers, around 20,000 healthcare workers have lost their jobs, out of which 7,000 healthcare workers were women, and more than 2,000 clinics have been shut down. So today, people of Afghanistan in generally, and then especially women and children of Afghanistan, they don't have anywhere to go if they need primary healthcare service, if they need secondary healthcare service, they don't have anywhere to go. Wajma has already mentioned, and also Heather, that even the situation was not for women's healthcare situation was not even like a very nice situation. But when in 1990s Taliban took over Afghanistan, the maternal mortality ratio was 1,600 of deaths of women per like 100,000 live births, and it took millions of dollars. It took thousands of midwives. It took like 20 years to bring maternal mortality ratio to 600 per 100,000 live births. So it took a lot of efforts of everyone, and now with it has been overturned within a night. And UNFPA has already given their estimates that this current situation could lead to 51,000 additional maternal deaths, 4.8 million unintended pregnancy, and a near doubling of the unmet need of family planning. So I think that though Heather was saying in her presentation that healthcare is kind of like more in the backdrop, and there are like other issues, but I think that the healthcare situation in Afghanistan is catastrophic. When it comes to maternal healthcare, the women of Afghanistan were depending on thousands of midwives. Will these midwives now feel safe to work in the presence of Afghanistan? Their life can be at risk, and also because is there even money to pay to these women? I think that when the dust settles down, we will see that Afghanistan would have faced brain drainage, healthcare workers, brilliant minds, people who could have built Afghanistan. None of them would have been left in Pakistan, because some of them would have to leave, unfortunately, to save their lives, and the others would have not been let alive by Taliban. So I think that the kind of situation, the humanitarian catastrophe that we are facing now, it is going to have a very long lasting impact on Afghanistan and the lives of women.
Thank you, Gulali. And let's go segue into next sort of deepening the conversation as well. I'll go to Dr. Pearson. So can you share some of the progress that has been made in health of women and children in the recent past, and what progress do we stand to lose if the global aid and support to programs and funding are cut as it is at present being cut? And international organization like yours, UNICEF, how is you planning to continue to make a difference? Can you share some of the work that you're doing currently, and if any challenges you are comfortable sharing?
Thank you. I will say from the situation, because many of my my panel members have already spoken to the current situation. I'm proud to say that UNICEF stays in Pakistan and we continue to deliver. Our presence is not just in Kabul, but in 13 field offices. We are aware the interruption of services, but we are also there to build it back. After the interruption of the World Bank and the IMF projects, I hope it is temporary. UNICEF, WHO, UNDP, and other partners are taking temporary measures. We're increasing the mobile health teams. We are expanding our support to cold chain, right? UNICEF we're famous for our immunization and the cold chain support. Every 1 out of 2 doses of immunization for children every day, every year, in every country goes through UNICEF system. So we are expanding the cold chain to hospital support, additional fuels when there is no electricity to keep newborn ward going so that sick and small children could continue to receive care. We understand the importance of keeping healthcare providers, female staff included, paid, so that they continue to provide essential health services. And UNICEF, just as we speak, is sending in tons of essential medicines to the country, nutrition supplies, antibiotics, and water and sanitation, infection prevention and control. These are really very important. Myself, I have been to Afghanistan before COVID. I went to Herat. I was in different hospitals around Kabul, I have seen how resourceful Afghan women are, right? And I think the future will be in their hands and in their children's hands for the brighter future of Afghanistan. And UNICEF is proud to be part of the journey. Thank you.
Thank you. Thank you very much. Going back to keeping the same conversation rolling, I want to go to Nagaya, CEO of the Action Partner Results International Australia. Nagaya, what are what most concerns you about the situation in Afghanistan when it comes to children's routine immunization services, especially the polio vaccine? I know that Results Australia is running a big campaign on polio this month. And I want to hear your thoughts on what concerns you most. And having worked with women all over the world, what are some of the gravest impacts of sidelining women's needs in relation to healthcare and broader socioeconomic landscape? And what are the benefits of and opportunities for elevating their voices? Over to you, Nagaya.
Thank you. Thank you so much, Vineeta. Firstly, just to say thank you so much for convening this really important conversation with these amazing panelists. So I really appreciate your work and the work of Action more broadly. I'm assuming we've got a global health audience, and of course, as we all know, immunizations are one of the most cost-effective interventions we can make in the public health space. And of course, they play such a key role in enabling children to survive and ultimately to thrive. And they've really helped shape modern history. So I can't underline enough the importance of vaccines more broadly. So of course, we're always concerned with when there's any threat to vaccine campaigns through conflict or instability. And of course, we're seeing that in dramatic form in Afghanistan at the moment. But on top of that, as you mentioned, Vineeta, Afghanistan's a particularly interesting country when it comes to polio. People may be aware that, historically up to 1,000 children every single day worldwide were paralyzed from polio. And of course, in the 1980s, a group of actors came together, the World Health Organization, Rotary, UNICEF, and others, and formed the Global Polio Eradication Initiative, which, had an incredibly ambitious aim and still does to wipe out polio from the face of the earth. And of course, the initiative has been incredibly successful. Incident rates have gone down by 99%. But the only two countries left on earth that still have the wild polio virus are, of course, Afghanistan and Pakistan. So we always have been worried, of course, about Afghanistan when it comes to polio and the importance of a really comprehensive vaccine program. But of course, the concern around Afghanistan has gone up since the Taliban seized control in mid-August of this year. I was really pleased to hear what Heather was saying, some pretty encouraging things around the Taliban and kind of their commitment to health more broadly. I think, when it comes to vaccines, their record is of course quite mixed. 20 years ago, they were broadly supportive of vaccine campaigns, but of course we know about, I think 2 or 3 years ago, they stopped people delivering vaccines in certain parts of Afghanistan that they were controlling. So a fairly mixed record. But then on top of that, as we've heard from other panelists today, of course, there can't be any effective vaccine campaign without women. Women are absolutely core to the health workforce in Afghanistan. So getting women back to work to really deliver those vaccines is critically important. And of course, ensuring safe access and safe roads and all of that is important too. So yeah, we are concerned, and absolutely Results and Action globally have been doing a lot of work historically around polio in particular. So really keen to see, what unfolds in Afghanistan over coming months and what the Taliban's position will be on vaccines more broadly. Ideally, of course, vaccines transcend politics, but of course, it's an incredibly complex environment. So if the Taliban are not supportive, it's obviously going to have, significant health security impacts for the region. Did you want me to go on, Vineeta, and talk about women being sidelined?
Yeah, thank you. I think we can also go to the next round. Thank you for checking, Nagaya. We have one panelist that will need to leave soon. So I was wondering if we can get her thoughts on before she has to go. Wasma, I'll come to you with my second round of questions that we were thinking about. First of all, thank you everybody for sharing your insights, and there will be some more discussion later. I was wondering, Wasma, if you can share some of your thoughts on what can international community do, whether it's at the individual level, whether it's an organization level, small or big, or the big players, big global mechanisms. Anywhere you want to start or finish is very valuable. Over to you, Wasma.
Thank you, Vineeta. Well, right now the situation is as dire as, like, on daily basis, we try to, send some money to our staff, our partners on the ground so that they can buy bread. Buying 15 avs bread is a luxury right now for so many people in Afghanistan, and this is because people have lost their income, and they don't have jobs, they don't have salaries, and the banks have been closed. So people who had even their salaries transferred, like we tried to transfer at least 3 months advance salary of our staff and many other of our partners, but then none of them can actually take that money from the bank. All of our accounts, all of that are frozen inside Afghanistan. So literally we are sending people the money to buy bread. So on individual basis, I think finding donations, collecting donations and sending it to the people in Afghanistan would be the first thing. At the same time, people, for women and girls who are part of different networks we connect with, even now top-up card for their phones is a big thing. Like they are not able to buy top-up cards for their phones. So phone credit, like there is an online website where we use and top up people's numbers. So if Afghans inside Afghanistan, if individuals, families, that would be big help. The other thing, of course, then comes the bigger part. Like, as I was saying before as well, like this, we were very much, delighted to hear that, okay, this $1 billion is coming to Afghanistan. It will change this humanitarian crisis, right? But what happened to that after a month? You're not even hearing. Where is that money? That money needs to go to Afghanistan, to the Afghan people. This needs to pay the salary of teachers, the doctors, the government staff. There are 2 million Afghans as part of the civil service, and so they need salaries, the universities and teachers, etc. So the salaries is like that money has to come to Afghans. That has been pledged actually. So this SRSG and also the UN Secretary General was announcing this with so much happiness that yes, we got this much money, but where is that money, right? The other thing, of course, is that Afghanistan's assets needs to be frozen, which has been frozen, needs to be unfrozen, but it shouldn't happen like unconditionally. The Taliban are asking, there is a leverage that the world has on the Taliban. The Taliban are asking for aid, the Taliban are asking for recognition, the Taliban are asking for political engagement. In all of that, so if they want to be part of the international system, they have to comply with the international regulation. It's as simple as that. So if I am, for example, the ambassador or foreign minister of Germany, and I'm meeting, for example, the Taliban, and when they are asking me for money, and I clearly say, what, these are the international rules, that you need to abide by these. And I know the Taliban are not in a situation or not in capacity to rule. They have been fighting an insurgency. They are not government. They have not had any, experience in government. And what they have also done is that they excluded all the previous government technocrats and people who were, civil servants. So they don't know how to run the government. They need expertise. They need, skilled Afghans, as well as skilled international experts, so that they could help them. And all of this needs to be negotiated. This has to be negotiated. All these meetings that happen with the Taliban leadership in Afghanistan need to have those outcomes clearly. because the Taliban are asking for money, they are asking for aid, they are asking for recognition. So, the right negotiation is that you give something, you take something, right? So what if you're asking the international community for money, for aid, for recognition, for political engagement, open your embassies, let your, missions to come and work in Afghanistan, then what is it that the Taliban needs to do? So that is not being happening. And I think, the world leaders who are engaging with Taliban, including their foreign ministers, they need to talk to Afghan women and who can actually tell them how to do these. And we have done this like for years, we negotiated, we bargained, little progress or steps. And even right now, many women in Afghanistan have started that. So the advocacy needs to continue, but people who can, like donations are needed, and the pressure on the aid organizations so that money which has been pledged to Afghans, this needs to come to Afghans actually.
Thank you so much, Wasma. And the key messages for the audience and to share when they go back to their organizations or through their social media is whichever way they can put pressure on the international global mechanisms or their governments or to negotiate a better situation for women and children in Afghanistan before they give any perks to them.
And include Afghan women in your conversations. If, for example, WHO is talking to the Taliban, they need to include women doctors in their, from Afghanistan as well, who can actually be present. So physical presence is as important at this point as the continued advocacy.
Absolutely, absolutely. And now let's go to Sadiqa with the same question. Sadiqa, what can the international community do? And please feel free to reinforce what Wasma said, something new, wherever direction you want to talk about. What can we all do in our individual capacity and part of the organizations or part of this global community to help alleviate the situation?
Well, thank you so much, Anita. And I'm so glad Wasma highlighted some very, very important points, particularly the commitment that the international community is showing that they are not going to abandon Afghanistan and going to, provide the help that is needed and basically save Afghanistan from becoming the largest humanitarian crisis in the world. But again, we want the talk to basically walk. It is only talk the talk. We want the action to be seen, and we don't have a lot of time. Basically, time is running out. The winter is around the corner. We still have thousands of people displaced from, those who have left their homes in provinces. They're still in Kabul, in different parks, in tents, living in tents. They don't have access to basic needs. As Wajma said, bread, a piece of bread is a luxury. So in a time of crisis like this, we cannot afford talking. It's time to really for international community to take an action. And again, we want the Afghan assets, the Afghans' money to be unfrozen. Again, I'm saying, this should be said a million times if needed, billion times if needed, that it should not be unconditional. The U.S. played a very, very poor role in, signing the Doha agreement with the Taliban, where there was no presence of women. That actually allowed, or a very slim to none presence of women, that allowed the Taliban to do what they are doing right now. And WHO delegation with no women, that's a very false role model that they are presenting to the Taliban. So what is important right now at the national level, it should be the social cohesion and social capital put in place. So we have professional health professionals and professional in all sectors that includes men and women. We have women as mothers. We have women as they're basically running the houses. We have women community leaders who have who were running shuras, the councils. So they all should be part of, what should happen next. They all should be part of identifying the current needs, and also they should be part of basically the solution. Now, for this to happen, well, we women advocates have been advocating for women to be in position, in decision-making roles. They should be at the table anytime the conversations are made, anytime the decisions are made. But that was a step where we saw ourselves growing. Now with the Taliban, there's a whole setback. Who can play a role in basically giving leverage to the advocacy efforts that we were doing before the Taliban time, and that is needed now, is the international community. So there is a need for that pressure. If the Taliban, they know that they cannot survive without having good relationship with their international partners. They cannot survive, their government cannot survive if they are not funded by the international community. So for that assistance to come, the international community should say, we want women professionals to be talking to us, like clear. We want women to talk to us. We want at the Ministry of Health, we want women to talk to us. At the Ministry of Education, we want, okay, you don't have women ministers, but there should be women in the conversation. So that is very, very important. At the same time, it's very important for the international partners, the civil society sector, and the nonprofit organization, the women activists all over the world, to basically pressure their government that, one, we cannot let Afghanistan to preserve the status quo that it is right now for the past 50 days, now about 2 months. They cannot afford this, because Afghan people cannot afford this. And also that they should pressure their government that no talk will be made without the condition of international community and the conditions that people from Afghanistan or women in Afghanistan want to be respected. So that is very simple. Basically, they need the support of the international community, and the international community should just make sure that the people of Afghanistan are heard, and also what women want internationally for the women in Afghanistan, and also for the Afghan people, that should be echoed.
Thank you so much, Sadiqa. As we all know that it's not possible to cover everything that can be done and that's happening in this short conversation, but at least it catalyzed all of us listeners to think about it more and engage more. So I'm going to go next to Heather with the same question. Heather, what can we do?
Thank you. So I want to talk really quickly about 3 things. First of all, voting in the Human Rights Council on a resolution about Afghanistan is happening maybe right at this moment. The voting session started about an hour ago. And there's a proposal that's being voted on to have a special rapporteur on human rights in Afghanistan. This is actually not as strong as what we thought was needed. My organization and many others were actually advocating for a fact-finding mission by the United Nations, which would have been a stronger mechanism. But a special rapporteur would still be an important step. And it is clear from the proposal that it would include a focus on violations of the rights of women and girls. So we should push for that to happen. Hopefully it will happen today. And if it is voted into place, then we should be pushing hard for that to get up and running quickly and to have a really robust capacity and focus on women and girls. Second, the UNAMA mandate, the UN mission in Afghanistan, its mandate was extended for 6 months in mid-September. UNAMA in the past has done quite a lot of human rights monitoring. Right now, they're a bit in disarray with a lot of their staff outside the country, but we should be pushing for them to get back in the country and to make human rights monitoring a big priority, including monitoring the functioning of the healthcare system and women's access to healthcare. And then the last thing I wanted to say is just on this topic of foreign organizations meeting with the Taliban without women. I fell down a little bit of a rabbit hole on this morning and started actually looking. And it's easy to look because the Taliban is posting photographs of many of these meetings. And so I wanted to actually name some of the countries and organizations in addition to, I actually didn't know about WHO. That's interesting. I'm going to add them to my list. But the Aga Khan Development Network. So these are organizations that have had all men meetings with the Taliban in recent weeks. International Federation of the Red Crescent, Médecins Sans Frontières, a Turkish humanitarian organization called IAHH, and UNICEF. Actually, I was surprised to see Shahrazad Akbar, the head of the Afghanistan Human Rights Commission, flagged that UNICEF recently had an all-male meeting with the Taliban. And then in terms of countries, it's a long list. China, Russia, Pakistan, Kyrgyzstan, Turkey, Qatar, Kazakhstan, Turkmenistan, Uzbekistan, the UK, and Malaysia. So I think that it's valuable to track this and to point out that this is unacceptable. Thank you so much.
That is so hugely helpful. And please, all the participants' handles are in the chat. We have posted them many times. And if Heather mentioned a couple of things that are happening right now, please follow her and her organization to keep yourself updated. And also if they have any call to action, to jump on it and support call to action if that calls to your heart. So I want to go next to Lu Wei to talk about the same thing. What do you think we can all do? And plus anything else you want to bring from UNICEF's perspective? Over to you.
Thank you. At the moment, UNICEF, because we're on the ground, right, in certain field offices, locations, we want to make sure the access is maintained, the peace corridor. And we want to prioritize on addressing immediate health needs and provide mechanisms to maintaining the Sahat Mandi project that used to be funded by the World Bank. We're looking at 1 month, 3 months extension and stop measures before we find a longer term solution. And we are stepping up our efforts in advocacy for girls' education, both primary and secondary, and investment in safe water supplies, treatment of malnutrition, and tackling child protection and gender issues. So UNICEF is active in Afghanistan and neighboring countries, Pakistan and others that are receiving refugees from and people moving across the borders and inside Afghanistan. Please support us so our capacity in the country is maintained to continue to deliver for women and children. Thank you.
Thank you. And we have UNICEF Health's handle also. Please do thank, I would encourage people to thank for their hard work and sustaining their services through this challenging time. Thank you. So next, I think we'll go to Gulali. Gulali, with the same question, what do you think we can all do?
Okay, so thank you, Vineeta. First of all, I want to say that the world needs to recognize that what happened to Afghanistan was a terrorist coup, and it should be dealt like a terrorist coup. Taliban do not represent the people of Afghanistan. They do not represent the aspirations of the people of Afghanistan. There were elections a year ago in Afghanistan, and people of Afghanistan used their right to vote to elect the people they wanted to see in the government. So first of all, do not treat Taliban as legitimate leaders of Afghanistan. Do not treat them as legitimate representatives of Pakistan. They are not. They are terrorists, that's period, full stop. And second, what I wanted to thank Heather for calling out organizations who have been going in a full male delegation to Afghanistan, especially for naming and calling out humanitarian organizations, because one of the principles of humanitarianism that is kind of like we are told again and again that one of the main principles according to the international humanitarian law is that these organizations have to be neutral. So if you are taking an all men delegation, it means you are not neutral, you are already acting political, and this is violation of the international humanitarian law. And I think there should be some kind of accountability for those international humanitarian organizations. We just do not need like accountability for Taliban. These international humanitarian organizations also need accountability for breaking their own principles of impartiality and neutrality, because not taking women into the delegation means, of course, it means erasing women's identity. It's a political action. It's not an apolitical neutral action. Then another thing that I wanted to highlight is that the international organizations and community really need to advocate with the neighboring countries of Afghanistan to open their borders for refugees, and with UNHCR to set up refugee camps. People from Afghanistan, they can come to Pakistan, but only if they have visa and if they have a letter from the Interior Ministry of Pakistan. It's not like really open for refugees. And we know that with the drought in Afghanistan, with the food scarcity in Afghanistan, and with healthcare situation, and with the threats to the life of the people, we really need to push for setting up refugee camps so that people can save their lives. And if they need to move out, they are able to move out. The fourth thing that I wanted to highlight is that, yes, already mentioned that Taliban do not have, Afghanistan was mostly dependent on international aid for running public sector, for running healthcare, education. So with stopping aid all of a sudden, Afghanistan is at the verge of collapse, and Taliban do not have those kind of resources to replace the international aid. However, I think it's kind of like, it's a very, international organizations have to find ways to provide support to the people, to run the hospitals in Afghanistan, to clinic healthcare centers, but that money should not like land up in the accounts of Taliban organization. We should not be financially strengthening Taliban. We should be focusing, the international community have to really focus on the people of Afghanistan. Taliban are terrorists, and people of Afghanistan should not be sanctioned. They should be provided support, but Taliban should stay sanctioned because they're terrorists, and we don't want them to represent women, Pashtun women, Afghan women. They don't represent us. Thank you.
Thank you, Gulali. Thank you so much. And with the same questions, we go to Nagaya to share her thoughts on what can we, all of us, do. Over to you.
Yeah, I mean, thank you so much, Vineeta. I can certainly talk from the Australian perspective in the sense of what the aid and development sector have been calling on the Australian government to do when it comes to Afghanistan. And this has been based on recommendations from Afghan people living in Australia. But I've got to say, this conversation today is really deepened my understanding, and I'll make sure it's fed back to other partners in Australia that are advocating on these issues. So, I mean, the main thing we're doing is really reinforcing to our government that we're a signatory to the UN responsibility to protect principle. So we have a responsibility as Australians, as an Australian government, to protect and fight for the health and human rights of the people of Afghanistan. And of course, as we've been talking about today, particularly the women and girls of Afghanistan. So we're calling in Australia for four things, and it's reinforcing to have heard this conversation today, because I think we might be on the right track in Australia, but we're certainly calling for unfettered access for medical and humanitarian relief to those displaced populations, both, of course, inside Afghanistan, but also in neighbouring countries. And of course, we know the overwhelming majority are women. So getting that humanitarian relief urgently is an absolute priority. We also believe that the Australian government needs to be an advocate for women and girls in Afghanistan. Of course, as ratified with CEDAW, and of course, Afghanistan also once ratified CEDAW, but particularly looking at issues around access to education, continued employment, ensuring especially those health workers. We're in the midst of a global health crisis, so ensuring those health workers are back at work, are being paid, that they have the resources they need to operate effectively, and really ensuring that women are in decision-making roles. And it's been fabulous just hearing about even the visibility of women, and all of us being mindful of that even in our own work is so important. But ensuring that women have decision-making roles, not just in government, but in civil society and NGOs. Thirdly, we're also calling for an increase in ODA. Our ODA has actually gone down, which is really disappointing given our involvement in the war in Afghanistan. We have bilateral commitment of about 50 million. 5 years ago, it was 150 million. So we need to be really increasing our ODA commitment at the moment. And as other people have said today, including through big NGOs who are operating effectively in country, if need be. And then finally, Australia, like many other OECD countries, has significant capacity to take on board more people from Afghanistan that are at grave risk. We've only taken on 3,000 people, which is extremely disappointing. So there's a need to really take on more people. And of course, I think so many people in Afghanistan would appreciate that. So that's from the Australian perspective, Vineeta.
Thank you, thank you. And we did post some information on the chat. Action posted some information about Sehat Mandi project and how it has been funded by the international organization, how it is under risk. And then we are also risk. And then also we have a call to action on how you can make a difference to have that huge resource release that we at Action Secretary are trying to mobilize support for. So thank you, Nagaya, for that, and all the panelists. I just want to reinforce some of the things that we have talked about. The current situation wasn't even good before August, but it's worsened so much that it's become a conflict to be just be able to breathe and to have access to healthcare, and they're not separate from each other. But at the same time, what do people do when they're struggling inside, and the aid communication and the international community outside? And this is a strong argument coming from the chat as well, is that how the neutral bodies that are supposed to be neutral, but they're not being neutral. They are actually, for example, kind of a sort of sitting silent in face of women's representation. For example, WHO's delegation. Women need to be engaged, right? Women need to be seen. All these organizations, international community and the aid organization, not need to change their own working to accommodate Taliban's viewpoint. They don't need to silence the women within their organization to oblige Taliban. So that sends a very, very strong, wrong message. And also we heard some of the really good call to actions. What we are going to do as our team, we are going to put together some of the call to actions that you shared with us and during this past quarter hour, and put it through the social media and tag all of you on it so that we can amplify that message and give people options to engage with any call to action that works with them. Any other thoughts or comments? I just want to throw it open to the panelists if they have seen some conversation in the chat they want to react to, or any broader thing for the panelists. Just an open floor for the panelists.
Vineeta, I just wanted to bring up one issue which is very much, I believe, is important, and we did not talk about, is the importance of mental health. Because in crisis, mental health is the one thing. I mean, as long as mental health and physical health, they both are important, but mental health, for the first time ever, I see that, like talking with my students, there are hundreds, and talking with my colleagues at Rouge Institute of Higher Education, talking with my own family and talking with my own siblings in Kabul. This is the first time ever that I see mental health as an issue brought up to me, that how it has been affecting everyone. It is affecting youngsters, it's affecting women, it's affecting men in the house. So this is one of the things, like when it comes to international support, and especially international organizations helping the health sector in Afghanistan, this is one of the things that I would really, really want them to know, that this is a service that is highly needed in Afghanistan. This was needed in Afghanistan. Now, I don't remember the exact study that I could quote from, but I had studied that there was like over 97% of the people in Afghanistan need some kind of mental health attention. So 97%. Now imagine with during COVID-19, the entire world has been impacted, and mental health has been becoming a very important topic all over the world. But yes, COVID-19 plus the crisis plus the uncertainty in Afghanistan is actually drawing so much need to this topic. So I would really appreciate if international organizations that are working in the health sector do think about mental health services in Afghanistan.
Thank you, Sadiqa. Any other panelists, if they want to bring up any other issue that we haven't talked about?
Yeah.
Or
I want to highlight one issue, and that is the safety of civil society organizations, local organizations in Afghanistan that really need to be advocated, negotiated with Taliban on the urgent basis, because the healthcare services were mostly provided in Afghanistan by local actors, by local organizations, women and local organizations who would be able to go door to door. And they were the forefront of the healthcare system of Afghanistan. And now, though Taliban had kind of like given guarantees that they will give amnesty to the government officers, people who had been working with NGOs or international community, but we have seen that Taliban are actually targeting again those actors who had some kind of role in Afghanistan. So the safety and security of civil society organizations really need to be advocated so that the civil society can thrive. Like I was, when I was getting ready for this webinar, I was just going through an article in Guardian, and I came across the story of an Afghan woman police officer. I would like to share that story because when I read it, it tripped my heart. This is the story of one of the 4 police officers, women police officers who have been killed by Taliban. And the Guardian article said that Nigar Masumi, a female police officer with 15 years of experience, was determined not to flee when the Taliban took control of her home province of Ghor in central Afghanistan. On Saturday night, gunmen who called themselves Taliban stormed Nigar's home. They took her husband and 4 of her sons in another room and tied them up. Then they beat Nigar with their guns and shot her dead. Nigar, who was 8 months pregnant, could not believe she would be killed because of her job. She had not listened to the warning of her families. And this is not just the story of Nigar. This is the story of many other people in Afghanistan who had been contributing to rebuilding Afghanistan. So their safety, their protection should also be a priority for the international community.
Thank you, Glali. Indeed, heartbreaking stories. And as you said, it's not just Nigar's story, but so many other playing out every minute. I still want to ask other panelists if somebody wants to add to anything. Okay. So I think that moving on to just recapping, one, I want to thank you everybody for sharing their deep thoughts, the participants being there and listening, and I hope they would engage more deeply. We do know that international organizations need to find a way to support Afghan people, not Taliban, but support Afghan people. The money needs to be directed through such means that it reaches the people. And currently the international aid funds are being frozen, and it deeply hurts the Afghan people. So they need to find ways, whether leveraging their handle on the resources to Taliban to agree to some at least basic minimum to allow women to work, get access to healthcare, or have a basic human rights pathway. Women not only need the access to healthcare, but the women healthcare worker needs to be allowed to work and operate. It's just not possible that women can have healthcare but cannot have education, and women need to be working in health sector. They cannot be educated as doctors, but only way women can get healthcare is through women doctors and healthcare providers. So this just doesn't compute. So it is all these problems are are intersecting and the solutions are intersecting too. So I hope that we have been able to encourage and inspire people through this conversation, plus through follow-up conversations that we are going to continue to have, to collaborate, to catalyze wherever they are in small or big way, wherever and howsoever they can do that. So with that, I just want to thank you so much for all the sharing that panelists had. And for a minute, I'm going to open the forum for everybody to unmute themselves so that we can say bye to each other, and also take probably in the Zoom world, take a screenshot. If people are comfortable with that, they can put themselves on the video. If they're not, then they can just keep their video off. Thank you so much. It just means a lot to us to be able to convene this meeting. Thank you. If people can unmute themselves and say goodbyes, and also be on the video so that we can take a screenshot. Thank you so much.
Thank you so much for this today. It was really informative and important. Thank you.
Thank you, Ken. Yeah, please feel free to chime in. We have a couple of minutes if anybody wants to say hello, bye.
Hello. Thank you for this meeting today. It's very informative. I hope we can help women worldwide by addressing some of these issues here.
Thank you.
Thank you. Ellen.
Hello, thank you. Thank you a lot for this information that deepens my understanding. This is Joyce from Kenya, and I'm praying for Afghanistan, that all will go well.
Thank you. Thank you, everybody. And we hope to connect with you through social media and stay in touch. Bye-bye.
Bye.
Bye. Thanks,
Bye.
Vineeta.
Bye, thanks.
Bye.
Bye.
Thank you.
Bye.